And turn on, yeah, good.
Hello, hello, everyone. We see you all are coming in. Welcome. Welcome, welcome. Thank you so much for joining us this evening. We'd love to hear where you are from. Wow, welcome. Thank you all for being with us. We see the numbers are going up. Please tell us where you're from. We'd love to find out. Welcome, welcome. Arkansas, welcome.
Arkansas, my home state. Oh,
yes,
okay.
Special affinity for Arkansas. Asheville, North Carolina, Seattle, Atlanta, welcome. Georgia, Connecticut, welcome. California, Massachusetts, Colorado, South Carolina. We're so pleased that you all are with us this evening. Colorado, welcome, Gloria. Virginia,
Delaware,
Denver.
Virginia, Dallas, Texas.
Dallas, Texas.
Houston.
Houston. Tennessee.
Memphis.
Welcome, New York. Awesome. Thank you. Florida, welcome. Chapel Hill, North Carolina, a personal favorite. Welcome.
Are you being partial to South Carolina?
North Carolina. Welcome, Deb. Thank you so much for joining us again.
Oh, there's
welcome.
my sister.
Oh,
my
awesome.
sister from California.
Also, so pleased to have you here. Thank you. Welcome, Michael. Thank you so much for being with us. And for those who are just, I see more coming in. It's already over 100 people. Hello, welcome. For those who are coming in, thank you so much for being with us this evening. We love to hear where you are from. And thank you for your patience. We will be beginning momentarily. Okay, California, welcome. Minnesota, Northern California. Susan, welcome. Louisville, Kentucky, welcome. Oregon, Indianapolis, welcome. We're so thankful you all are taking your time to be with us in this wonderful conversation tonight. New Jersey. Yes.
It's Canada.
Yeah, because I believe so. Michigan, welcome. So thankful to have you with us. I'm seeing some familiar faces, some new. Welcome to all. Incredible. For those who are coming in, we love to hear where you are from. Las Vegas, welcome.
So I think we'll go ahead and start.
Okay, and welcome, James. Thank you all so much for being with us this evening. My name is Dominique Hardy, and I serve as a program manager for the Center of Racial Healing, where Dr. Catherine Meeks is my shero and our executive director. We welcome you to a glorious evening for us to have a conversation about intergenerational mental health and racial healing. And we also welcome our esteemed panelists. At the appropriate time in the conversation, we will ask you all to please place your questions in the Q&A box, which is different than the chat box, and you are welcome, obviously, to chat with us throughout the session. And if for any reason we have any internet connectivity issues, which we do not foresee, but if we do, we ask you to kindly just use the same link to re-sign in, and we will reconnect within 3 minutes time. And so without further ado, I will present to you my shero and the executive director for the Center for Racial Healing, Dr. Catherine Meeks.
And Dominique Harding is quite a propagandist, so just keep that in mind as you listen to her talk about me. We have a great time working together, and I'm so delighted to have her and so delighted to have all of you, many of you who are joining us again for one of our programs, for which we are deeply grateful. And then our wonderful panelists tonight who are helping us with our effort to help in educating our community and the communities of folks that are represented here tonight on this important subject of mental health and racial healing. And we are honored to have with us tonight. I will introduce the speakers in the order that the panelists in the order that they're going to speak. So I'm beginning with Dr. Marcus Griffith, who's a specialist in child and adolescent and adult psychiatry and obesity medicine at Kaiser Permanente Hospital. And when I first met Dr. Griffith, he made a huge mistake, because when I asked him if he would be willing to be a part of this panel, he said, yes, and I'll do anything you ask me as long as I can work it out. He doesn't know what he got himself into. But I'm so grateful to welcome you here tonight, Dr. Griffith. Thank you. And he will be followed by a lovely Fulton County Commissioner, who serves also as Vice Chair of the Fulton County Commission, Madam Vice Chair Natalie Hall. And I'm so delighted to meet you and to have you be so gracious as to come and spend time with us this evening. And then she will be the second speaker. And then the third speaker will be Dr. Abby Myers, who is a holistic and strength-based psychologist who uses that approach to mental health and wellness with the people that she works with, who's also a staff person at Kaiser Permanente Hospital. I cannot tell you all what it means to me for you to take time to come and help us do some exploring around this whole issue of mental health and racial healing. And it's so important, I think, for us to be taking this approach where we have practitioners and policymaker together talking, because we split things up in funny ways, and things don't work the way they should because the approach is oftentimes not holistic. And when it comes to mental health and when it comes to racial healing, these two things are too important for us to miss a step in trying to figure out how to really do something that can make a difference. And I am impressed by these people's work and commitment to this journey in terms of their intention to not just be doing the window dressing stuff that gets done sometimes, but to really be doing the work that's substantive and that can be sustainable. At the end of the day, no matter what it is that we have taken on as a task for ourselves, the bottom line question to be asked and answered is, did we really do something today that improves the quality of life of the people in the community? And if we cannot say yes to that question, we need to keep our heads down and be very quiet until we can say yes. So, Dr. Griffith, I invite you to begin us, and then we will move along here. And after each person has spoken, there will be an opportunity for the audience to pose questions. So you may want to kind of be keeping those in mind so that we can just jump right into it, because even though it seems like we have a lot of time, the time will go really fast. Dr. Griffith.
Thank you. So I had some things prepared, and many of them went away. So when those things go away and I lose my path, I have to always make sure that I turn to the Lord to give him thanks, ask for his blessings, and give praise. That happened today because of something came across my my phone that said the verdict is in, and I'm sure every one of you felt this same sense of panic, anxiety, that even though we saw this 9-minute display of brutality in front of us over and over and over and over again, we still had this feeling that something could go wrong and likely could go wrong. And so that's where we are today. And we give thanks and praise because he is a God of justice. And we thank you for you strong women right here on this panel being a part of this with Dr. Meeks and Ms. Hardy and Commissioner Hall doing this, and my friend Abby Myers. For Dr. Meeks with this Absalom Jones Center and what he meant to us and our people. What Commissioner Hall has done with Fulton County and recognizing racism as a health social problems. This is like something that should be common sense, but we have to take a stand on this. And thankful we have these people here taking a stand, and all of you people in the audience is a part of this, taking this stand. So when I look at this and think of this, I pose this question about mental health, racial healing, and trauma that didn't just begin today. Today is just one of those days that we continue to have this fear of suffering and needing to have racial healing and reckoning. So in terms of mental health, I always ask this question about this. What happens when a child loses all hope and ambition? What happens when it's easier to find a vial of crack cocaine, a nickel bag, or a 40 ounce of beer, as opposed to a park or community recreation center? What does it say about our society when there are more African-American men in jail or prison than there are in college? So those are social and societal issues that link directly to our mental health and our mental health care needs and the trauma that's experienced as a result of these discrepancies in care. Racism is a health care problem, period. Identified by the American Academy of Pediatrics, American Academy of Family Medicine, the AMA. It is a health care problem. And so the most pressing examination of this, I tip my hat to our former Surgeon General, Dr. David Stacher, who did a report in 1999, I'm sorry, entitled Mental Health, Culture, Race, and Ethnicity. Now, we know that these problems began before that time. 1619 and before, America has struggled with matters pertaining to race, ethnicity. It has even been legitimized through laws, slavery, Japanese internment, Indian relocation, Jim Crow, and these new voting laws that have been acted in this state and other states are part of this legalization effort that impacts our psychology, our mental health, our well-being. And so Dr. Stacher in his report identified these as significant problems. He stated basically this, is that the disparities from minorities in mental health services may be primarily based on racial and ethnic challenges, that when mental health care is received, many times it is inferior, they may be less likely to receive it, and have difficulties in access to care. Racism has been identified in this report and several other notable reports that recognize these problems. One, racial stereotypes and negative images are often internalized that impact one's self-worth. For example, the doll study that was referenced in the Brown versus the Board of Education, when white dolls were given to Black children, and they preferred them over dolls that looked like themselves. This stereotype has been ingrained in our psyche. Racial stereotypes. 1. 2, racism and discrimination by societal institutions have resulted in minorities and lower socioeconomic individuals living in poor conditions, affected by poverty, crime, violence, and the persistent stressors of that environment that affect their mental health. Racism and discrimination, as we know, are stressful events. Just look at how we felt today. That is an impact of racism. So we think about George Floyd, Breonna Taylor, Trayvon Martin, Ahmaud Arbery, and so many others that continues to ruminate in our mind about, is this fair? How could this happen? This clearly affects our emotional state. We think about the role of stigma, stereotypes, and mistrust of mental health services. So these are recognized potentially as problems. We know what the problems are. So we have to identify the problems in order to come up with solutions. So one, we have to make sure that mental health and mental health services is a priority. And we look at various state governments. Mental health programs often are considered low-hanging fruit for the slashing of budgets. Let me mention several states. In the past 3 years, California cut their mental health care budgets by $587 million. New York, $132 million. Illinois, $113 million. Arizona, $106 million. You guys get the picture. So these things are whittled away. So as we know, when you eliminate these services and we have a problem that surfaces, you can't just suddenly provide services for these folks. When we think about that situation that just happened several days ago in Indianapolis, this person clearly had a mental health care problem. He'd been taken into a psychiatric facility. His guns had been removed. He was then able to get it back, and we saw what happened next. When we think about, again, trauma, intergenerational trauma, how this continues to happen over and over and over again, we need to find solutions. So some of the solutions are this, is, for example, what our Commissioner Hall has done in Fulton County, identifying ways to help the community through community outreach and services such as this, identifying through the policy statement, and then putting resources behind that to support our communities in mental health care services. Making sure that we have adequate training so that we can recruit more minorities into the mental health care fields. So when we look at the mental health care workforce throughout this country, good luck finding a person of color. So there is clearly a shortage in the psychiatric workforce. So there was a census done by the American Medical Association in 2010. We have not gotten the census yet from 2020, but it looked at the psychiatric workforce. 55% are white, 4% are African American, 5% Latino, 15% Asian, 20% unknown. So think about this, African Americans, 4%. And you know where they all live. Atlanta, LA, DC, Chicago, Houston. Then, as we know, whether it's a Black psychiatrist or white psychiatrist, the best, they don't take insurance. They take cash only. So then the burden then falls on those who are underinsured, who have no insurance, or even if they do have insurance, the difficulty in finding quality services. So it has to happen again from the ground up in creating a workforce that's representative of the community. So many medical schools, such as the one Kaiser Permanente has founded in California, is geared toward bringing more minorities to represent what that community looks like. So it's easier when you have someone that looks like you, who understands where you're coming from when you have a conversation. Kaiser Permanente, the company I work for, our workforce is majority minority. Our workforce is reflective of what the city of Atlanta's population looks like. And so we hope that we can see more models of organizations that create their workforces that look like the community, especially when it pertains to receiving healthcare and healthcare services. So what each of us have to do, because we are all patients, we have to make sure that our healthcare companies deliver exactly what we need for us. When you're a paying customer, you should be able to make demands for your services. So I think my time is up for right now. I'll pass it on, and then we can talk more about some of these issues when we have the question and answer section. Thank you.
Thank you, Dr. Griffith. Madam Vice Chair.
Thank you. Thank you. It's a pleasure to be here on behalf of the Fulton County Board of Commissioners and the residents of District 4 in Atlanta. I'm your Fulton County Commissioner, Vice Chair Natalie Hall. And for those of you who are in Atlanta or Georgia, and for those of you who are not, just to give you a bit of the district boundaries that I represent downtown Atlanta, Midtown, and the surrounding neighborhoods of downtown, northwest of the Mercedes-Benz Stadium to the Charlie Brown Airport on Fulton Industrial Boulevard, Atlantic Station, Grady High School, and I go below I-20 to the Andrew and Walter Young YMCA. And it's an honor to be invited here by Dr. Meeks and the Absalom Jones Episcopal Center for Racial Healing to discuss the intergenerational mental health and racial healing crisis that we're facing today. You know, intergenerational trauma generally refers to the ways in which trauma experienced in one generation affects the health and well-being of descendants of future generations without exposure to that original traumatic experience or event. So yes, I definitely believe there's a connection between racism and poor mental and physical conditions. I was elected by the constituents of District 4 to serve them and to serve Fulton County in its entirety. We are actually mandated by the state to provide health and human services to the residents of Fulton County. So I've ensured that I do my part to make this happen by passing, sponsoring, and introducing resolutions pertaining to racism, mental and physical health. An example, I sponsored a resolution called Racism as a Public Health Crisis. This declared racism as a public health crisis in Fulton County and established a task force. My resolution was different from those around the United States and currently in DeKalb County and CDC and others, because I added a component to it to create a specialized task force that would study and evaluate existing county policies, programs, and services to promote and support these policies, programs, and services that prioritize access for people of color to healthcare and 6 other resources that promote healthy lifestyles. And so the task force will be able to come back to the Board of Commissioners and recommend to us whether or not there are programs and services and policies that we need to omit or create and vote on or institute within our departments to serve the public. I also created a resolution. Oh, and by the way, that did pass the Board of Commissioners. And so it is effective. Yes, thank you, Dominique.
Hey.
Thank you. And then I also created and sponsored a resolution to approve a memorandum of understanding with Emory University Hospital in Midtown Atlanta. And this will allow Emory University Hospital of Midtown to purchase outpatient drugs at a discount, authorizing they're giving them the ability to sell these drugs at a discount price for those who come to the hospital for health services and surgeries who may need these prescription drugs and they can't afford them. So they now have the ability to buy them at a discount. And that also passed by the Board of Commissioners in Fulton County. Most recently, at our last Board of Commissioners meeting, I also co-sponsored a resolution on reparations. For those of you who may not know, Evanston, Illinois was the first city in the United States to pass reparations. And I just happened to have been raised in Evanston from junior high school to high school. And so hello to my Evanston Township High School classmates who may be watching or listening. Evanston was first in passing this. And the way that they did it is they looked at the US House bill, which was HR 40, which asked for a study to be done on reparations and slavery. And they took that, and the first step was to look at all of their laws that they had passed from the 1900s to present day and pull the laws that actually created racist situations for the Black community in Evanston. And then they had already instituted the sale of cannabis, which provided a 3% tax. And they used that the funds from the 3% tax to take $10 million to fund the reparations. And so those Evanstonians who historically have families starting from back in the 1900s who were impacted due to redlining and other racist measures were able to benefit from the reparations program, receiving about $25,000 each out of that $10 million. And they're also instituting a housing program to help those Evanstonians who are still living there in the Black community to be able to move to even better housing because they still live within those red line districts even today. So on the Fulton County side, we actually passed a resolution to create a task force, a reparations task force that will research the feasibility of slavery reparations for Blacks who live in Fulton County, Georgia. And that passed as of last Wednesday. And thank you. And I also, I talked to some heart transplantation patients about the fact that they were able to or not able to get heart transplants because they had Medicare and Medicaid, and found out that Medicare and Medicaid does not fully fund the heart transplant. So there are literally people who are living day to day in fear of dying because they can't get the heart transplant. And so I created a resolution that was sent forward to our state legislators during the session to ask them and urge them to please look at the Medicare and Medicaid laws and change them so that people on Medicare and Medicaid can get the heart transplants. And my fellow colleagues voted to move that forward to the state as part of our legislative package. So I'm really happy about that. So I just want to offer to anyone who is interested, if you would like a copy of these resolutions to see them yourselves, please feel free to contact me. You can reach me at my office at 404-612-8226, or you can email me at natalie.hall@fultoncountyga.gov. And I am on Facebook, Instagram, and Twitter at FulCOD4. That's FULCOD and the number 4.
Thank you, Madam Vice Chair. Dr. Myers.
Thank you so much for having me. It's such an honor to be included in this group. I think whenever we are in an environment like this and we are talking about issues of racism, it's important to acknowledge that I am a white woman in this group. And so I just want to name and state that and recognize that and the privilege I hold about some of the topics we'll be discussing, and that I have not experienced racism. So I'm definitely coming from a different perspective than some of the people who are on the panel and may be attending. And I just simply want to acknowledge that. That also means I'm not always going to get it right. And that would be one of my top suggestions for people trying to do this work, is to be willing to take a risk, that trying and apologizing when you make a mistake and learning from that and using that as an opportunity for growth is the best way to facilitate change for ourselves. Wow, I have so much to say and so much kind of, as Dr. Griffith said, change this afternoon. Let's see, I think the first thing I want to acknowledge is that we have our feelings and our emotions for a reason. They're there for a reason. They give us information about ourselves and our world and our relationship. And we are often taught in our families to not pay attention to our emotions, especially if they aren't happy. And then there's some gender stereotypes there as well, where women are socialized to only be happy or sad. We're not allowed to be angry. Particularly women of color have added pressure to not express their anger. Men are often socialized to only be angry or happy, and they get called names if they express sadness or other vulnerable emotions. So what I want to say is that our feelings are there for a reason, and the more you tune into them and pay attention to them, the more you're going to be able to care for yourself and to learn ways to express them that are healthy and good for you and not harmful. But I think we are often taught to fear our own emotions and to just push them down as deep as we can. And sometimes we have to survive, to just move on and to get through the day and to work and feed our families and care for ourselves. But when you can pay attention to those feelings that you're having, that gives you the power to do something with them productive, instead of giving power away to others who might be triggering very validly so some of those reactions. My area of expertise is in interpersonal and complex trauma. So it's often not a fun topic to discuss at parties, but I want to speak a little bit more to what Madam Vice Chair Hall mentioned with the intergenerational trauma, and I want to touch on the element of vicarious trauma. So trauma is our response to fearing for our own safety or our life, or for the safety or life of those we care about. And so the feelings that we have in response to that are normal, even if they're interfering with your functioning. The things that are done to us or to those whom we love are not normal. That's what the problem is. Your reactions, your fear or anger or shutting down or isolating or even acting out, those are normal responses to something abnormal happening. I think that's really helpful to recognize that there's not something wrong with you if you're feeling some of those reactions. That's why we're able to name it and to often help, reduce those symptoms and treat what you're going through, the reaction piece of it. Vicarious trauma used to be talked about just in the sense of those in the helping profession, firefighters and EMTs and medical doctors. We've been learning more and more, definitely since 9/11 on moving forward, that simply witnessing or watching or hearing about other people's trauma can be triggering in us and cause a trauma reaction. And then when you start to layer that with your own experiences of trauma, whether it was abuse or neglect in childhood or a difficult relationship that was abusive in adulthood, or absolutely racialized violence, experiencing racism. So we all have our own histories. And then you add on the constant bombardment in social media and in the news of watching images and videos over and over and over again. It certainly is a balance of staying well informed and being aware of what's happening in our community and not looking away from painful, hard, horrible experiences so that we're not able to allow ourselves to pretend like it's not there. So it's necessary to expose ourselves to some of that, but it's also necessary to take breaks for your own mental health. Our mental health is an essential part of our overall health. Mental health isn't something that you catch. We all have mental health and we all need to be caring for it on a daily basis, just like we should be doing for our physical health. So sometimes that means pressing pause and not watching the news or being online for a few days, or better yet, not watching at all, but simply reading so that your brain is not exposed to the constant flood of traumatizing images and videos over and over again. So to find that balance for you, but absolutely even the fiercest advocates take breaks from the news cycle for several days at a time, because if you want to be able to pour into your community and your family and the causes that you so fiercely want to advocate for, you have to have something to give. So that means we have to pause to fill ourselves up. I want all of us to be able to give out of our abundance and not at our expense. And so we have to stay tuned in to how we're feeling so we can know, okay, I'm at a place where this is taking a toll on me. I need to pause and shift to do some self-care. So I want to share a story that I heard before Senator Warnock was Senator Warnock. He was Reverend Dr. Warnock, pastor of Ebenezer Church here in Atlanta. So I have the great privilege of just living down the street from that congregation. And so I went to a book discussion that Ebenezer hosted several years ago with an author named Monica Coleman. And she had just written a book called Bipolar Faith. So she shares in this book her experience in her own family, and she identifies as an African-American woman. She is an ordained minister in the Baptist Church, and she also has a Ph.D. and teaches in college. And so she talks about the journey of figuring out her experiences and getting an accurate mental health diagnosis. And when she finally was able to do that, she wanted to read some stories about women like her who had gone through that to help her, cope. And she couldn't find any books about mental health by women who were African American. So she wrote her own. And Reverend Warnock had her to his church to talk about mental health. So as a therapist myself, I thought that was huge that this powerful voice in the African American and the Christian community was using his platform to have an open discussion about mental health. And he shared a story there, which I will not say it as elegantly as he did, but the point of the story that he shared was that he said his congregants, his church members will reach out to him and say, Pastor, I'm going into the hospital for surgery tomorrow. Will you please pray with me? And he says, absolutely. And he prays with them. And then they go to the hospital for their surgery. And he used that as an analogy for mental health, that absolutely you should continue to stay connected to your church community and to pray for healing. And you should go to your therapist or your psychiatrist and take care of your mental health. Just like you would go have that surgery, even though you still ask your pastor to pray for you. Mm-hmm. And so that really stood out to me. And I think that's a really helpful way of balancing our faith with our healthcare and not feeling like we have to pick one or the other. And sometimes we have these myths that are passed down through generations about our mental health, that we can't be a good Christian, for instance, and be depressed. And that's not true. And so I think as we start to challenge more of those myths, and people like Dr. Griffith, who's a man of color, can use his platform to share so publicly, that really helps to destigmatize when you see people like yourself. And so I'm thankful for Reverend Dr. Warnock, now Senator Warnock, who represents me, shared his power and platform in that way. And even hearing the numbers Dr. Griffith shared, it made me very thankful for my own professional training, which was here at Georgia State in Atlanta. that almost all of my supervisors and professors were people of color. And so I realized how rare that must be, hearing some of the statistics about mental health care professionals. So I'm very grateful and thankful for that. Okay, I'll pause there.
All right, thank you. And Dominique, before we start with questions, I've got a couple of things that I need to ask the panelists. Dr. Griffith, I would love to ask you, as a child and adolescent psychiatrist, to just take a couple minutes to talk to us a little bit about the impact of COVID upon our young people, because I think that there's a lot that's happened around that, and I don't know that we've talked about that much at all. And I think it's important for that to be a part of this discussion.
Thank you. So starts out with this, I went to medical school almost 40 years ago. And in all my years of medical training, we were never prepared for anything like this. So you think about this. You hug your friend today. Next week, you have a cough. The following week, you're in the ICU. The next week, you could be dead. Never seen anything. We can't imagine anything like this. So, how do we help our children with this, to deal with this emotionally? First, how do we help them? Is to model for them with care, kindness, love, common sense. Wash your hands, wear your mask, socially distant, and then get vaccinated. Those are the first things to do. Next, do what Dr. Myers said. Turn some things off. This stuff will drive you insane. Anything really important, you're going to know. Like, I remember I was in Washington, D.C., January 26, 2020. My phone started blowing up with text. That's when Kobe crashed. Anything big that happens, you're going to know. So you can turn things off and know that if something goes awry, you're going to know. So helping our children. So fortunately, we also live in a place here where there are lots of great park systems. Fulton County has probably, the hottest thing in town with that beltway thing. Ride your bike, walk, be safe. While you're walking, you can sing, you can pray, you can exercise, you can lift your spirit, you can be in a safe place. DeKalb County, we've got the path, we got Arabia Mountain, Panola Mountain. Take your kids and help them to be explorers. So those are some of those basic things. Now, finding help with professionals such as myself or Dr. Myers, it is very hard. There was already a shortage before this thing happened. And then when this thing happens, it's all hands on deck. Good luck finding the appointment. And this time really is where we have to really make sure we emphasize how important our public mental health and our public healthcare systems are, because when this thing happened, the burden fell on Fulton County Board of Health, DeKalb County Board of Health, Clayton County Board of Health. They were undermanned, they're understaffed, and then the burden of this vaccination fell on them for getting vaccinated and getting even mental health. So this becomes one of those things that we have to make sure that it is a priority. It has to be a priority. So getting the help you need to reach out to, if you have clinical anxiety, clinical depression, prayer is helpful, Exercise is helpful, but you cannot pray and exercise it away. It may require counseling, therapy, medication. So, and how do you find a good person is talk to somebody you know who can direct you, because you don't want to necessarily do anything blindly.
Right. And as a follow-up, in a few weeks, we're going to be hosting a town hall meeting with the District of Health and the District Director, I should say, not the District of Health, but the District Director of Health for Fulton County, and also the Director of Behavioral Health and Disabilities Unit for Fulton County. But for right this minute, Madam Vice Chair, I would like to, excuse me, say how appreciative I am to hear that you have passed resolutions to get medication for people who would not be able to get medication. But do we have a similar vehicle for people to get mental health services who don't have Medicaid or insurance, but who have the need? Is there, where do you go? How do you get help if you don't have those resources?
Thank you for that question. It's a very good one, Dr. Meeks. I'm happy to say that Fulton County services are free to our residents, because that's what we're mandated by the state to do, is provide health and human services. So we have the Department of the Board of Health, which actually has health centers all over Fulton County. You can find those on fultoncountyga.gov. We have a Department of Behavioral Health and Developmental Disabilities, which offers all sorts of behavioral and mental health services, also in conjunction with Rest Care and with some other contractors that work in that field. We work with lots of doctors who want to provide services to the community, many of them from the Morehouse School of Medicine and other places. Grady Hospital is a partner, of course, and we just continue to try to support the nonprofits that also work in these areas. So there are lots of services that are available to the community of people who are considered the least of these, who may not have the resources to pay for them. We have those services in Fulton County, and that's why we're the #1 county in the state of Georgia and the largest county in the state of Georgia.
Yes, thank you. And when we advertised this town hall, we said that while we're in Georgia and we're dealing with issues that relate to Georgia, but we understand that these are issues that face people all across the country. So wherever you happen to be, perhaps you know about the services that are available in your particular location. But if you don't, it might be good to look into that. And it's also might be good to connect to some of the elected officials to, if there are deficits, then connect to some of the local officials and lobby for better mental health services. I feel a great responsibility to be mostly evangelistic about mental health, because I feel like we are so committed to physical health and so uncommitted in so many instances to being concerned about the health of the soul. And so it's a topic that I just don't think we can talk about too much. And I think across the whole United States, we have, as Dr. Griffith pointed out earlier, with all of the cuts in mental health services. And as soon as you run out of money, that's the first thing you get rid of. Like you get rid of the art programs and the physical education programs in schools, the very things the kids need so they don't go bananas, we get rid of. And that's really kind of how we approach this. And I do want the audience to know Dr. Jennifer Gander is here with us as kind of a silent member of on the screen. Excuse me, Dr. Gander is an epidemiologist from Kaiser Permanente Hospital and is actually responsible for helping to bring Kaiser people to the table at the Center for Racial Healing. And I don't want this time to end without publicly acknowledging her presence and saying thank you, because the whole business of trying to do the work in the community that needs to be done, it's best done when we have the good sense to collaborate and share the resources and know that collaboration gives us more resources and not less, even though sometimes we get caught in all kinds of funny places that make us not so sure about that. So I think, Dominique, I don't know what questions we have yet, but let's go ahead and hear them.
Yes, we have quite a few. A lot has been sent to me privately. They're incredible questions. The first one is, are there currently scientific explorations around the possibility that racism itself does stem from mental illness?
So doctors, don't go mute on us now.
So I was trying to find the unmute button. I didn't want to kind of do like that without saying anything. So here's what is that there are certain mental health conditions that may be tied more often with racist behaviors. Okay. And those are the personality disorders, namely the antisocial personality disorder, the sociopath. And so, if we have to identify one specific mental health condition, it is that. And unfortunately, we don't have any kind of medication that will treat that. Many times these personality disorders are developed as a result of how these people were brought up. And that's where racist attitudes, racist ideas, and racist beliefs become embedded in one's psyche. So this is not necessarily the antisocial personality disorder, but let me give the example of how this gets built in one system. So my little brother, a cute little boy, was in the third grade. He went to an all-white school. He was the only black kid in the class, and it was picture day. And there was a little young girl, white girl named Melissa, that they liked each other. They were just friends. They exchanged pictures. The next day, she gave my little brother the cold shoulder. Would not say anything, nothing. So my brother finally was able to talk to her, and she said this to him. She said, "My daddy said we cannot be friends anymore because one day you might hurt me." My brother was very distraught. He went home, and my mother noticed something was wrong, and you all as mothers, you could recognize something when your kid's something's not right. She said, "Sean, what's wrong?" My brother told her a story, and she said, "Sean, she should be very thankful to have you as a friend. It is not your problem. That's their problem."
And Dr. Griffith, to add to that, from a research standpoint, unfortunately, we don't grow up in a vacuum, right? And so to your point and what you were talking about with the doll study that is very well known, as well as Dr. Kamara Jones, who I know Vice Chair Natalie Hall is part of your resolution, and she's a tremendous force, and she does a really great job talking about this analogy about the gardener, right? Unfortunately, we don't live in a vacuum, and so it's really hard to figure out this causality. But it is one of those things that seems to be cultivated over time, and mental health and racism definitely play in. And you've just got to, as all of our esteemed panelists have talked about, you've got to treat the mental health stigma. You've got to treat the mental health diagnosis. You have to treat those problems, as well as continue to be that champion and voice, as all of our esteemed panelists. And thank you, Vice Chair Hall, for all that you've been doing about fighting it also at a policy level, while also trying to take care of your mental health. It can feel overwhelming at times, but I think it's an important question, but I think it both needs to get addressed at the same time.
Thank you. The next question is, are there any insights, and I think this will be what Dr. Myers was speaking of, are there any insights into the cellular mutations due to trauma that affects mental health? You spoke about vicarious trauma. So specifically too, there was another question that I will combine in regards to the effects of slavery on people today.
I can answer the biologic part of that one.
Go ahead.
Is that we can't see these things at your cellular level, but we can see some of these differences structurally. So when you do kind of PET scans and MRI scans of the brain with people who are traumatized, you can see changes in their brain structure, namely like the hippocampus. And so there are certain areas of the brain that do become changed as a result of experiencing trauma.
Yeah. And
It has to do with your body's stress response. So, you know that feeling when you're driving and you slam on your brakes because the car in front of you slammed on their brakes, and you feel that and everything tenses up for a moment. And then when you hopefully don't hit the car in front of you, you feel that relief afterwards. That's your body's stress response kicking into gear. When we've been exposed to a lot of traumatic experiences in our life, like systemic racism and, you know, Dr. Griffith's brother's story, those types of things, where who we are at our core is challenged or threatened, we become primed to where our body, our brain can kick into that stress response without there being an actual threat present. And so that change kind of primes you to be what sometimes the world will call too sensitive, which is, I don't like that word because it implies there's something wrong with you, but it's your brain responding to something that may or may not actually be happening in real time because of the past experiences.
Oh,
and
very
so
interesting.
I want to say something about that when it comes to racism, because it appears to me that that racism requires the victims to kind of stay in that space of expecting something to happen. It's almost like it's, you know, waiting. You and you may not even realize it yourself, that you kind of have this. It's almost like a subterranean concern about something's gonna get you, and you don't. It's oftentimes not even named, I don't think. And I think that's when Du Bois talks about double consciousness, when that Black people live with double consciousness and two-ness and three-ness. It's as if you live on this level where you're functioning here on this level, but then there's all this subterranean stuff going on all the time, which because you have been traumatized over and over and over, and even though today the trauma might not happen, but your body remembers it, your brain remembers it, and you live in that kind of stance waiting on it. I wonder how much that impacts upon just the capacity to live, the capacity not to go crazy, and the capacity to not end up having your life shortened because of the wear and tear on your body. Yes. I would really, I mean, is that, wouldn't you say that that's kind of one of the things that happens to oppressed people? that they have this, even though there may not be trauma today to you, the memory of it is almost impacts you almost as much as if it was actually happening. Because physiologically it is happening, right? I mean, it doesn't matter whether, as long as you have the memory and it hasn't been healed, then, which is why it's so important to be able to have the therapeutic processes that can help you get well, help you first of all to name it.
Yes.
Right.
Yeah.
There's power.
Dr. Meeks, you asked a question. I thought you just said something about slavery. Was that you or Ms. Hardy that asked a question about the effect of slavery?
Yeah,
yes.
It was, yeah.
One of the wonderful participants, yes.
One of the participants. I'm glad that I have my pants on, because you know how it happens here. When you do these programs, people are dressing with this, but you know, sometimes people say, there you go again, bringing up that slavery stuff.
Yeah.
It ended in 1865. I've got proof of this picture. I got a picture that I want to show you that proves that it did not end necessarily 1865. Okay, I'm gonna see if you guys can see this picture here. Can you guys make that picture out there?
Yes.
Okay, that picture was taken in 1963. And in that picture, you can see a bunch of women standing around. Okay, so 1963, that was right around the time of, Martin Luther King's I Have a Dream speech. So in that picture is my great-great-grandmother, on my mother's side. So my great-great-grandmother, my great-grandmother, my grandmother, and my mother. And my other side is my great-grandmother, my father's side, and then my other grandmother. So I got all these grandmothers around me. So my great-great-grandmother was born in 1863. She was born in the time of slavery. She was never a slave, but you know the things about slave attitudes. I asked my great-grandmother about my grandmother Cynthia, and she said, sometimes I see mother crying for no reason at all. She had cat-o'-nine-tail marks on her back. So how is it that a 10-year-old child who's caring for white children has whip marks on her back after slavery had ended? So when you think about this picture, what one person says to the next and says to the next and says to the next, fortunately, their message to this young man in 1963, he becomes a doctor who he is now. And so I talk to people about this, is that, my great-grandmothers and grandmothers and so forth, they only had a third grade education, but they're the smartest people that I ever knew. The difference is I had opportunity that they didn't. They had to start working when they were kids. And so I show that picture to say how even though slavery ended in 1865, whatever, the ideas are still alive because of what's being told from person to person to person to person. So that trauma of slavery is still there. It's not that far removed. And that stain, we have to do what we can to remove it. Like what we're doing right here today, what our vice chair is doing with the city of Atlanta, Fulton County. That stain is still there.
Yes.
Wow, thank you.
Thank you.
So many other wonderful questions. We're trying to move along here. One of the next ones is, what is the line that you all would draw between keeping updated on the news? For example, they said if someone wanted to watch George Floyd's, actually the tragic death, really, that was caught live, versus not traumatizing ourselves. Where do you draw the line?
Like so much of mental health, my answer is it depends. And it really depends on each of us. We have different ways of coping with the world, and we have different histories and experiences. As much as I want to stay informed, I know for myself, watching videos of murders is not something I can tolerate. I'm going to know about it, but I'm not going to watch it. And that even translates to the type of movies and TV shows that I watch. I don't like to watch anything that is violent. It just affects me too much. And so I'm going to make sure I know about the real world things that are happening, but I don't watch those things. That works for me, but it might not work for others. And I know that there again is power in bearing witness to the pain others are feeling and have gone through. But you have to find the way that works for you to be able to stay connected, but also take care of yourself. So it depends.
And I think you have to be honest about what the impact is upon you. You don't have to watch it just because it's there. You have to be, is this helpful? The question is this helpful? Does it help me to be who it is I'm trying to be? Which takes a bit of capacity for self-reflection. And you don't just, I did not watch one bit of the George Floyd trial. I had friends who did watch it because they needed to. I didn't need to. And it was important for me to make that distinction and not go watch it because my friends are watching it, because
Right.
that's what we, you know, well, I don't want to look like I'm not up to par. I'm not with it. Well, all I have to do is close my eyes and I can see the whole thing. I don't ever have to watch it ever again, and I can just close my eyes and it's right there. So why continuously traumatize myself with it? But you're so right, Dr. Myers. I need to know that about myself and be honest enough to have the courage to make the best decision for myself. And I think we have to really encourage people to do that. Dominique, I want to take a little bit of privilege and I want to ask Madam Vice Chair a question that has to do with what difference is it going to make in Fulton County for us to declare racism as a public health threat? Can you talk about what your vision is of how that will make a difference in terms of our going forward?
Absolutely. But first, I do want to say to Dr. Myers, thank you for a comment that she made earlier in the discussion where she said that, you know, there are triggers in watching other people suffering and watching them go through their traumatic experience. And that helped me a lot because earlier today, when I was told that we were going to evacuate our Fulton County Government Center and our facilities due to the verdict coming down, because we were not sure how that verdict would turn out and how people would react to it. And we didn't want to put our employees or our constituents who may have been utilizing our services at risk in any way. So we called for an evacuation of the building. And so first that, you know, put me on edge. And then I felt like I really need to watch the verdict. And when the verdict came down, I cried so hard, like it was my own family member. And I was thinking to myself, why am I crying? I just could not stop. I went tissue after tissue after tissue. And I felt so relieved though. And I thought about it and I said, you know, it could be any of us. It could be anyone. And I felt that so deeply with that verdict, but it was a sense of relief that we finally have seen some justice in some way, even though we still have more work to do. And so when you spoke about triggers, it put it all in perspective for me, and I appreciate that. So to go on and answer your question, Dr. Meeks, from our viewers, the resolution is very specific in what it will be able to do. So you don't have to guess about what it's going to do. You don't have to wonder or try to, you know, think of what it'll do. It specifically states that there will be a creation of a task force that will evaluate, study, and recommend to the Fulton County Board of Commissioners what we need to do moving forward, based off of them looking at our policies, our programs, and our services to see if there are any inequities in any of those areas. And so if they see any current policies, programs, and services that have some trace of racism in them, they can recommend to us that we either completely abolish them or that we change them to make them more fair and equitable, or they can recommend new policies, programs, and procedures. So that is going to actually create an action so that we actually do something. And that's why I put the task force in there, even though the other resolutions all around the United States and in other places do not have a task force. Whenever I create a resolution, I always want to do something. I don't want to just declare it as racism as a public health crisis and just leave it there. We need to have action behind that. So the task force will be that action.
Thank you. And I just want to say one more time, I know people can understand how to replicate the things you're hearing here tonight. But if you don't have such a resolution coming out of your commissioners or whoever your policymakers are in your particular locales, then this could be an encouraging set of comments here tonight that might help you look into that or lobby for that, because the more we can raise this issue around the country, the better it will be for us. And we'll come back to you now to the questions from the audience.
And Dr. Mix, just one other thing, they can go in the chat. I did put my email address there. So anyone who would like a copy of the resolution, because I've been sending this around the United States to my colleagues who are commissioners in other counties, so that they can utilize the language. It can be used anywhere. So you can get a copy from natalie.hall@fultoncountyga.gov and just check the chat.
Thank you.
Thank you so much. I mean, just phenomenal responses, all of you, and thank you, Vice Chair Hall. Actually, the next question was for Vice Chair Hall again. How long do your resolutions passed stay in effect, and does the resolution bill about the heart include other organs?
The all resolutions stay in effect until someone tries to amend it or change it, abolish it. But as long as no other commissioner brings forward another resolution to amend or abolish, it remains there and it remains active. I put no limitations on my resolution so that they would stay in place indefinitely. And what was the second part of your question?
Does the resolution about the heart, the person wanted to know, does it include other organs?
No, the constituents that came to me were heart transplant patients who were waiting day by day to figure out a way to get their heart transplant done. And unfortunately, they had Medicaid and Medicare and told me that that was part of the problem. It did not cover their heart transplantation. And so that's why I created that resolution specifically for heart transplantations.
Thank you so much. The next question is, how can we get more psychiatrists and psychotherapists willing to serve the underserved on a pro bono or very cheap rate? Do we need even more medical schools?
Yes. So this is also, part of social justice and the injustices. So when I went to medical school, to me, it cost a lot. My total debt for medical school was $50,000. Now it's $100,000 per year. So if you go to medical school, when you're done, you could owe $400,000. So for that reason, lots of other folks are saying, you know what? Return on investment, if I put $400,000 here in the stock market, I can retire, when I'm 40. So we have to make sure we do some things in terms of making medical education affordable so that it is not something only for the rich. So that's one thing, is that systemic racism is responsible for why we are in this situation from the get-go. So Abraham Flexner report from 1910 closed there used to be like 10 Black medical schools. It closed them all with the exception of 2.
Wow.
Howard and Meharry. So if you go back and you think back about all the older Black doctors, they only went to 2 places, Howard and Meharry. So you automatically right then created a shortage moving forward. Flexner recognized that. It became an economic advantage for white physicians. So because you didn't have enough Black doctors, he wanted Black doctors to only take care of Black people. Because you didn't have enough Black doctors and so forth, then white physicians could cherry pick the so-called good Blacks. So that helped to set up this problem that we're still facing today with a shortage of physicians, let alone mental health physicians. So when you think about the economics of medicine, Pediatrics and psychiatry are some of the lowest paying professions. So when you look at the economics, you say, I'm not going to go and be a psychiatrist. I need to go and be a cardiologist or surgeon where I can get paid for my time. So it's a big, big thing. It really is. But we have to make medical education more affordable. Then we have to have more people going back that we emphasize the importance of science, mathematics, biology, technology, so that young people engage and embrace wanting to be a doctor, wanting to be a psychologist early on in life.
Wow, thank you. I know that
We
our
probably have time for about one more question, and then we want to ask the panelists and include you as well, Dr. Gander, to have a few last words.
Okay, so many more fabulous questions, but the last one is, can you address the Black on Black violence among young people? And in conjunction with that, the person noted that the last 3 incidences of gun violence were caused by 19 to 21-year-old men. So how can we take care of our young people, but young men?
Can I jump in
Sure.
there?
Absolutely.
Okay. Before COVID-19, I found that our young men from the 8th grade to the 12th grade, I'm not putting an age on it because I found that there are young men in 12th grade who are 21 years old. So when I put an age limit on it, I was restricting those young men who were older than 18 from participating in my conferences for the youth. So I now just say 8th grade to 12th grade. But I found that there's so many Black and brown young men who do not have fathers in the home, or may have fathers, but they don't know them, or they may have fathers who are just absentee dads, and they have no mentors. They're in bad situations. There are in Atlanta, a lot of foster kids and a lot of homeless kids. I know this because I have the most Atlanta public schools inside of my district, and work with many of the Atlanta Public School Board representatives. So I created a youth conference called Empowering Young Men to Excel, and it was to be an annual youth conference. The very first conference I had, there were so many overwhelming responses to it. I could not fit all of the young men into the conference center. I had to cap off at 300 because there were so many that wanted to attend. But with the 300 that we did, and they were all from Atlanta Public Schools and Fulton County Schools, and then those organizations that have truancy programs and other programs for young men, they brought their young men as well. And I had a panel of elected officials, CEOs of companies, film and entertainment industry actors, and men from all walks of life, all types of backgrounds and business. And just talking to these young men, found out that they are in a lot of pain. And they are, one child stood up and asked the question of the entire panel of men, how do you mentally and emotionally deal with the anger that you're left with when you don't have a dad in your life? And I ended up having to bring on board for the next year's conference mental and behavioral health practitioners. We had to literally add a workshop so that some of these young men could go and talk to someone before they left the conference.
Wow.
So there's a great need for help in that area. And I challenge anyone to please, contact me if you do anything in that area in Fulton County in Atlanta, because I'm trying to figure out where we are with COVID, so that possibly I can continue this conference sometime soon.
You hit the nail on the head, Commissioner.
Yeah.
Part of good mental health is also love. the ability to love and receive love. And, be a big brother, be a coach, be a mentor, a rites of passage program. Those are things that are necessary to uplift the community so they feel worth and have self-worth, and then don't take that anger and frustration out in becoming a gang banger, and then inflicting more violence on yourself and the community.
Yeah.
Thank you. Dr. Gander and Dr. Myers.
I would just add to that question that the brain is not fully formed until we are 25 years old. And the last parts of the brain to form are impulse control and long-range planning. So if you think about those 19 to 21-year-old white males who are perpetrating the violence in our communities, their brains and the impulse control are still not developed. And so that raises big policy questions when it comes to regulating firearms and service in the military. And, how old do you have to be to rent a vehicle? 25 years old. There's a reason, there's science behind that. There's so much of our policy outside of what Commissioner Hall is advocating that is not based in science. And so I love hearing all the stories of the hard work that you're doing that's evidence-based, because in my experience, that has not been the norm, but it matters so much. I think my final words for the group is I just want to remind everybody that whatever feelings you experience, they're valid because you're experiencing them. No matter how different they might be from others around you, sharing similar experiences in the world, your feelings are valid and you matter. And it takes a great deal of strength and courage to say, I am not at my best and I deserve to feel better, and I'm going to get the help to help me along that journey.
Yes, thank you. Dr. Gander.
The only thing I would add to what our fantastic panelists have already said is, especially, Vice Chair Hall, as you mentioned with COVID, and Dr. Myers and Dr. Griffith, to your point, there's a lot of trauma that we're all experiencing right now, that we've been experiencing since 2020, and it's not going away, it's building. I think we're all feeling the burnout in all of our professions, right? We're seeing it every day. And I think we need to build off of what Dr. Griffith, you were saying, be a good neighbor, keep your door open. And although, especially here in Atlanta and in other cities where, the vaccines they feel like they're getting rolled out, and, we're starting to take that breath of fresh air. Unfortunately, in terms of mental health, I think the studies have shown that when there is such a trauma to the community, such as a pandemic, such as this disease has caused, mental health is always lagging, right? So what we might be seeing now with our infectious disease and our physical health and how it might be getting better, how we might feel safer interacting with others, mental health is still needs to be a priority. And unfortunately, you always see a wave of, suicide increases right after a pandemic when people are starting to recover. So I think as a community, as neighbors, as brothers and sisters, we just need to keep an open door and realize that even though we might start feeling a little bit better as COVID goes away, the policies Vice Chair Hall are putting in place, the patients that Dr. Griffith are talking to, and just being good neighbors is very important. And it's not going to go away when COVID goes away, because the mental health need is still going to be there. So thank you all for coming and being willing to stay on this panel. And thank you to all of our attendees and participants. I really appreciate it. This is a very important topic. And Dr. Meeks and Dominique, thank you for bringing us here tonight.
And I thank you all very much. And I want to thank our audience, first of all, and also all of the panelists. And always, I'm grateful to Dominique for her expertness and amazing energy that she brings to all of the work. I want to say to Madam Vice Chair Hall, I am so appreciative of your spirit as an elected official. We have too many elected officials that don't do anything.
Yes.
And your commitment to the people you serve is clear. And all of us want to thank you and applaud you. And I'm so looking forward to working more with you, because this is what we need is policymakers who understand why they have been given the right to even be a policymaker. So thank you. I cannot say enough thank yous to you. Thank you, Dr. Myers, Dr. Gander, Dr.
Thank you.
Griffith. And I also want to let everyone know that Kaiser Permanente and Fulton County commissioners are co-sponsors of this event, and you will be seeing many more such events. We are committed to constantly hosting these gatherings and trying to build an organic kind of wellness conversation across this country, because that is what we need to get ourselves in a better place. Dr. Gander said, you need to keep your door open. I want to add to that, you need to keep your heart open. We all need to keep our hearts open for the folks who pass by us so that they can have a home. Because my wonderful teacher and mentor, Howard Thurman, says the only place you can find refuge is in another person's heart. And I think the Center for Racial Healing is committed to being a brave space where we tell the truth and we try to have an open heart. And we want so much to model that in the world. And so visit our website. And if you win the lottery or just find some extra money lying around, send it to us. Because we need to have support to do the work we do, and we'll do it if we have to sell fish sandwiches like the old folks used to do. We'll do it, but we don't want to. We prefer not to. So thank you all so much for being with us and for the work you do and for the lives you live. And Dominique will be sending you a recording of this evening's panel, and you will be added to our database. Those of you who are new, those of you who are returning, you're already in our database, and we will keep you informed about things as we go forward. And we hope that everybody will be a half a shade braver because you have been here tonight. Good night.
Good night.
Night.
Night. Thank you.
Thank you.
Bye.